It's easy to think of heart trouble as sudden chest pain, that classic image we've all seen. But what if your heart is sending you signals? Quiet whispers you might be dismissing as just part of getting older. After 60, our bodies change, and sometimes those changes mask important health messages. We might feel a bit tired, a bit achy, or notice things that seem minor, things we brush off, thinking, "Oh, that's just my age." But sometimes, these subtle, even strange symptoms can be your heart telling you it needs attention. Ignoring these signals because they don't fit the typical picture can be a painful reality. The truth is, heart issues don't always announce themselves with dramatic flair, especially as we get older. They can be sneaky, showing up in unexpected ways. But if you know what to look for, you can catch these signs early. In this video, we're going to uncover 6 of these often ignored, strange symptoms that could reveal your heart is in trouble after 60. These aren't the obvious ones, and that's why it's so important to pay attention. Knowing about them could make a world of difference. So, stay with me and watch to the end, because there's something coming up that might genuinely surprise you. Now, let's dive into these unusual signs your heart might be trying to show you. The first symptom we need to talk about, and it might seem really strange to link it to your heart, is pain or discomfort that shows up in your jaw, neck, or back. Yes, you heard that right. Not your chest, but your jaw, neck, or back, especially for women. This can be one of those silent alarms. Think about it: you wake up with a stiff neck, or maybe your jaw feels sore, like you've been clenching your teeth all night. You might blame it on sleeping funny, or maybe you've been stressed. You might even think it's just a touch of arthritis acting up in your neck or upper back. And often, it is just that. But sometimes, when this pain is persistent, or it comes on with exertion, or it's accompanied by other subtle symptoms, it could be what doctors call referred pain. See, when there's an issue with the heart, which sits in your chest, the nerves sending pain signals can sometimes get confused and register that pain in other parts of the body, often in the arms, neck, jaw, or back. This is particularly true during things like angina, which is chest pain or discomfort caused by reduced blood flow to the heart, or even during a heart attack. For some people over 60, especially women, jaw pain, neck pain, or upper back pain might be the only symptom they notice, or it might be the most prominent one, completely overshadowing any discomfort they feel in their chest, which might be very mild or non-existent. Imagine you're doing some gardening, something you normally enjoy, and you start feeling an ache deep in your jaw, maybe radiating up towards your ear, or a nagging pain between your shoulder blades that just won't go away until you stop and rest. You might initially think you just pulled a muscle or strained something, but if that pain consistently shows up when you exert yourself, like climbing stairs or carrying groceries, and then eases when you sit down, that's a pattern worth paying very close attention to. It's the pattern that's key here. Pain that is linked to physical activity and goes away with rest is a classic characteristic of angina. Regardless of where the pain is located, it's like the heart is saying, "I'm not getting enough blood flow when you make me work harder," and it's projecting that discomfort to another area. This is different from chronic arthritis pain or muscle soreness, which might be more constant or related to specific movements or positions rather than just general exertion. So, if you start experiencing unusual, recurring pain in your jaw, neck, or upper back, especially if it happens when you're active and stops when you rest, don't just dismiss it as age or a bad night's sleep. It's a signal your body could be sending, and it's wise to get it checked out. Your doctor can help figure out if it's just musculoskeletal or if there's a possibility it's related to your heart. It's always better to be safe and understand what your body is trying to tell you. Don't let the strangeness of the symptom make you ignore it. That's precisely why it's on this list of subtle signs to watch for after 60. Another symptom that many people over 60 might attribute to just getting older is unusual or excessive fatigue. Now, feeling a bit more tired than you used to is perfectly normal as the years go by. Our energy levels naturally fluctuate, but we're talking about unusual fatigue here, a level of tiredness that is significantly different from your normal baseline, or fatigue that comes on suddenly and profoundly, making even simple tasks feel overwhelming. This isn't just needing an afternoon nap. This is feeling completely wiped out, lacking the energy to do things you normally do, even things you enjoy. Maybe you find yourself needing to sit down and rest halfway through preparing a meal. Or you feel utterly exhausted after a short walk that used to be easy. This kind of fatigue can be a sign that your heart isn't pumping blood efficiently enough to meet your body's needs, particularly when you're active. When the heart is struggling, it has to work harder to circulate oxygen and nutrients throughout your body. This extra effort and the reduced supply reaching your muscles and organs can manifest as profound tiredness. Think about it like this: if your car's engine isn't working properly, it uses up fuel faster and doesn't have the power it used to, leaving you with less range and a sluggish feeling. Similarly, a heart that's not functioning optimally can leave your whole body feeling drained. For example, you might notice that getting dressed in the morning leaves you feeling winded and needing to sit down, or that by mid-morning, you feel like you need to go back to bed, even if you slept through the night. This isn't just feeling a bit sleepy, it's a deep, pervasive tiredness that affects your ability to function. It might also show up as a sudden decrease in your ability to do physical activities that were previously manageable. Perhaps you used to walk a mile comfortably, but now you struggle to walk even a block without feeling utterly exhausted. This isn't just feeling out of shape, it's a sudden or noticeable decline in your stamina and energy levels. It's important to distinguish this from temporary fatigue caused by lack of sleep, stress, or a common cold. Unusual heart-related fatigue is often persistent and doesn't significantly improve with rest. It's a chronic feeling of being drained, even when you feel like you should be rested. It can also be more pronounced in the evening, as your heart has been working all day, and its reduced efficiency becomes more apparent. Many people, especially older adults, dismiss this kind of fatigue, thinking, "Well, I'm not young anymore. This is just how it is." But while some age-related fatigue is normal, a significant, unexplained increase in tiredness could be a critical warning sign. It's your heart potentially signaling that it's not keeping up with your body's demands. If you find yourself experiencing this kind of unusual or excessive fatigue, making you scale back your daily activities considerably, don't hesitate to discuss it with your doctor. They can help determine if it's related to your heart or another underlying condition. Paying attention to how your energy levels change is a simple but vital step in monitoring your health after 60. It's not about dwelling on every little ache or pain, but about recognizing persistent, unusual changes that could indicate something needs a closer look. These strange symptoms, the jaw, neck, back pain, and the unusual fatigue, are often overlooked, precisely because they don't fit the typical picture of heart trouble. But they are signals nonetheless, and understanding them is the first step to addressing them. Now that we've discussed these two surprising signs, let's move on to another symptom that might seem unrelated at first glance. Continuing our discussion on strange symptoms, the third sign that your heart could be in trouble after 60 is swelling in your feet, ankles, or legs. This is medically known as edema. It might show up subtly at first. Maybe your socks leave deeper indentations than usual, or your shoes feel tighter by the end of the day, especially if they fit fine in the morning. You might notice that your ankles look puffy, or that if you press your finger into the skin on your leg or ankle, it leaves an indentation that lingers for a few seconds. What's called pitting edema. Why would swelling in your lower extremities be related to your heart? Well, your heart's job is to pump blood efficiently throughout your body. When the heart, particularly the right side, isn't pumping as strongly as it should, blood can back up in the veins. Gravity naturally pulls this blood down towards your feet and legs, If the heart isn't able to effectively pump that blood back up to the chest, fluid can start to leak out of the blood vessels into the surrounding tissues in your lower legs and feet, causing them to swell. This kind of swelling tends to be worse later in the day because you've been upright. Allowing gravity to have its effect, it might also improve overnight as you're lying flat, and fluid can redistribute. Think about a plumbing system if the main pump isn't strong enough. Water can start backing up in the pipes furthest away and eventually leak out. That's a simplified way to visualize what can happen with heart-related edema. This isn't just swelling from standing for too long on a hot day, which usually goes away quickly. This is persistent swelling, sometimes even painful. That doesn't resolve easily. You might notice your rings feel tight on your fingers too, as fluid retention can affect other parts of the body, but swelling in the lower legs and ankles is a very common manifestation of heart failure, a condition where the heart muscle is unable to pump enough blood to meet the body's needs. It's a sign that the circulatory system isn't working effectively. Many people might dismiss this swelling as just poor circulation, or a consequence of varicose veins, or even just being overweight. While these things can contribute to swelling, persistent, significant swelling in both legs that doesn't have another clear explanation should definitely be investigated by a doctor. It's a tangible sign that your heart might not be handling its pumping duties as efficiently as it should be. So, take a moment to look at your ankles and feet today. Are they usually this puffy? Do your socks leave marks that take a long time to disappear? If you notice persistent or worsening swelling, it's a conversation you need to have with your healthcare provider. It's not just an inconvenience. It could be your heart calling for help. Moving on to the fourth strange symptom, unexplained shortness of breath, particularly when you're lying flat. Now, feeling breathless after strenuous exercise is normal. Even getting a little winded climbing a couple of flights of stairs might feel normal after 60 if you're not particularly active. But we're talking about shortness of breath that is out of proportion to your activity level, or that happens when you're not doing anything particularly strenuous, or even when you're at rest. One very specific type of breathlessness that can be a sign of heart trouble is orthopnea, shortness of breath that occurs when you lie down flat, and which improves when you sit or stand up. People experiencing this often find they need to use extra pillows at night to prop themselves up so they can breathe comfortably. Sometimes they might even need to sleep in a recliner chair. Why would lying flat cause breathlessness if your heart is having issues? When you lie down, fluid that might have accumulated in your legs and lower body during the day can shift and redistribute into your chest and lungs. If your heart isn't pumping efficiently, it can't handle this extra fluid volume effectively. This fluid buildup in the lungs makes it harder to breathe. It's like trying to breathe through a wet sponge. This shortness of breath isn't just feeling a little puffed. It can be quite distressing, making you feel like you can't get enough air. You might also experience paroxysmal nocturnal dyspnea (PND), which is similar, but even more frightening. You might wake up in the middle of the night feeling suddenly breathless and needing to sit up or stand to catch your breath. This is often a sign that fluid has accumulated in the lungs while you were sleeping flat. Again, many people might attribute mild shortness of breath to being out of shape, carrying a few extra pounds, or even lung conditions like asthma or COPD, which are also common after 60. And it's true that these things can cause breathlessness. However, if you notice new or worsening shortness of breath, especially if it happens when you're not exerting yourself, or if you find you need to sleep propped up, it's crucial not to ignore it. Your heart and lungs work closely together, and breathlessness is often a key symptom when the heart isn't functioning well, leading to fluid backup in the lungs. This is another signal that your heart might not be able to keep up with the demands. Even simple demands like lying down. Don't just accept breathlessness as an inevitable part of aging. Describe exactly when it happens to your doctor. Does it occur with exertion, at rest, when lying down, or does it wake you up at night? This information is incredibly valuable in helping them determine the cause. Recognizing that breathlessness, especially when lying flat, isn't normal and could point to a heart issue is a vital piece of knowledge for anyone over 60. Let's move on to the fifth strange symptom that might signal heart trouble: dizziness or lightheadedness, sometimes even to the point of feeling faint. Feeling a bit dizzy occasionally can happen for many reasons: standing up too quickly, being dehydrated, certain medications, or even inner ear issues. However, if you're experiencing frequent episodes of dizziness or lightheadedness, especially if they seem to happen without a clear external trigger, it could be related to your heart. Your brain needs a constant, steady supply of oxygen-rich blood to function properly. If your heart isn't pumping blood efficiently, or if there's a problem with your heart rate, either too slow, too fast, or irregular, the blood flow to your brain can be reduced, leading to feelings of dizziness or lightheadedness. Think about it. If the pump isn't pushing enough volume through the pipes, the taps furthest away might just trickle. Your brain is relatively far from your heart, and it's very sensitive to changes in blood flow. For example, you might feel woozy when you stand up from sitting or lying down, and while a brief head rush is sometimes normal, persistent dizziness upon standing could be a sign that your heart isn't adapting quickly enough to pump blood upwards against gravity. A condition sometimes related to blood pressure regulation issues stemming from the heart or nervous system influenced by heart function. Or you might feel lightheaded even when you're just sitting down, perhaps feeling like the room is spinning slightly, or that you might pass out. These sensations could be linked to arrhythmias, abnormal heart rhythms. If your heart beats too slowly, too quickly, or irregularly, it might not be pumping enough blood to your brain, causing dizziness. Sometimes, these episodes might be accompanied by a feeling of palpitations, like your heart is skipping a beat, fluttering, or racing. It's crucial to distinguish between occasional, explainable dizziness and recurring, unexplained episodes. If you find yourself frequently feeling unsteady, lightheaded, or like you might faint, it's a sign that needs medical attention. Don't just put it down to being clumsy or a senior moment. It could be your heart struggling to maintain adequate blood flow to your brain. Describing these episodes accurately to your doctor is important. How often do they happen? What are you doing when they occur? Do you feel your heart rate is normal or abnormal? This information can help pinpoint the cause. Dizziness and lightheadedness are often vague symptoms, which is why they can be dismissed. But when linked to potential heart issues, they are anything but minor. They are your body's way of signaling that the power supply, the blood flow from your heart, might be intermittent or insufficient. Paying attention to these seemingly minor sensations is a key part of being proactive about your heart health after 60. It's another strange symptom that isn't chest-focused, but is definitely heart-related. Finally, the sixth strange symptom that could indicate heart trouble, and this one might seem particularly odd, is changes in your appetite or experiencing nausea. Most people don't immediately connect digestive issues with their heart, but there's a link. When the heart isn't pumping effectively, it can lead to fluid buildup not just in the legs and lungs, but also in the abdomen. This fluid accumulation can affect your digestive organs, leading to feelings of nausea, loss of appetite, or feeling full very quickly after eating just a small amount. Imagine your abdominal area feeling bloated and uncomfortable due to extra fluid. This pressure and congestion can impact how your stomach and intestines function, making you feel sick or simply not hungry. Furthermore, with reduced blood flow from a struggling heart, your body might prioritize sending blood to vital organs like the brain and lungs, potentially reducing blood flow to the digestive system. This decreased blood flow can also affect digestion and lead to symptoms like nausea. Some people might also experience pain or discomfort in their upper abdomen, which they might initially mistake for indigestion, heartburn, or a stomach bug. While it certainly could be those things, if this abdominal discomfort or nausea is persistent, unexplained by diet, and perhaps accompanied by other symptoms on this list like fatigue, swelling, or breathlessness, it could point back to a heart issue. For instance, You might find that you're just not interested in food anymore. Losing weight unintentionally because you feel nauseous or full all the time. Or maybe you feel fine before eating, but soon after starting a meal, you feel uncomfortably full and a bit sick to your stomach. This isn't the same as the occasional upset stomach. It's a chronic feeling of discomfort or disinterest in eating. Again, these symptoms are vague and can be caused by many things, which is why they are often overlooked in the context of heart health. People might assume they have a lingering virus, or that their digestion is just slowing down with age, or that a medication they're taking is causing side effects. While these are all possibilities, it's important to consider the heart as a potential culprit, especially if these digestive symptoms are new, persistent, and occur alongside other signs. It's your body's complex system reacting to the core problem of reduced heart function. So, if you've noticed a significant change in your appetite, are experiencing unexplained nausea, or feel uncomfortably full after very little food, and it's not clearly related to something else, it's worth mentioning to your doctor, particularly if you have risk factors for heart disease or are experiencing other symptoms from this list. Now, taking a step back and looking at all these 6 strange symptoms, the pain in the jaw, neck, or back, the unusual fatigue, the swelling in the feet and ankles, the unexplained shortness of breath, especially when lying down, the dizziness or lightheadedness, and the changes in appetite or nausea. It's clear that heart trouble after 60 doesn't always look like what you might expect. These symptoms are often subtle, easily dismissed, and can vary greatly from person to person. They are your body's way of trying to tell you something isn't quite right with your most vital organ. It's easy to attribute these changes to the natural process of aging, and sometimes they are. But it's incredibly important to differentiate between what's normal and what could be a signal of something more serious. Remember, these signs aren't definitive proof of heart disease, but they are red flags, reasons to pause, pay attention, and have a conversation with your doctor. Being aware of these less common symptoms empowers you. It allows you to be proactive about your health, to ask the right questions, and to seek medical advice when something feels off, even if you can't quite put your finger on what it is or why it might be related to your heart. Don't feel like you're bothering your doctor by bringing up what might seem like minor or unrelated symptoms. Healthcare professionals are there to help you figure out what's going on, and providing them with a complete picture of all the changes you've noticed, no matter how strange they seem to you, can be crucial for a correct diagnosis. Early detection is key when it comes to heart health. Addressing potential issues early can lead to better outcomes and help you maintain your quality of life. So, please, listen to your body. Be mindful of these subtle signals. They are not just random occurrences. They are pieces of a puzzle your body is presenting to you. You've lived a full life, and you deserve to continue living it with vitality and peace of mind. Don't let the fear of what it might be prevent you from finding out what is. Taking care of your heart is one of the most important things you can do for yourself as you navigate life after 60. It's about being informed, being aware, and being proactive. These strange symptoms are simply clues. And following those clues by talking to your doctor is the smart and responsible thing to do. Remember, small changes in your body can sometimes make a big difference in understanding your health. Your well-being is precious. I hope this information has been helpful and has shed some light on how heart symptoms can manifest in unexpected ways after 60. It's about arming yourself with knowledge so you can take the best possible care of yourself. If you've experienced any of these symptoms, or if this video has given you something to think about regarding your own health or that of a loved one, please share your thoughts or experiences in the comments below. Your experience might help someone else who is going through something similar. We can learn so much from each other, and if you found this video valuable, please give it a like. That tells us we're providing content that matters to you. And don't forget to subscribe to our channel for more helpful information, tips, and advice on living your best life at every age. We're here to support you on your journey to health and happiness. Thank you for watching, for taking the time to invest in your health. Live your best life at every age.